Hi, I'm Dr. Douglas McKenzie. I'm going to talk about capsulectomies and what are the differences. We're talking about breast implant capsules and capsulectomies. Okay, so there are many different reasons why someone would have a capsulectomy, which is removing the body's scar capsule around the implant. So the body produces a scar capsule around the implant, and even in normal situations with no problems, there's a scar capsule, and you usually don't even know it's there, right? Well, if you have an issue or you desire the implants to be removed and the capsule to be removed, capsulectomy. So a total capsulectomy involves removing all the capsule and the implant. An en bloc capsulectomy involves removing all the capsule and the implant. So what's the difference? Well, with an en bloc capsulectomy, we're taking out the entire capsule and the implant within it in one piece. Okay, that's what we're trying to do, and we're trying not to make holes in it. That doesn't always happen, but we're trying to do that to kind of preserve the integrity of that space and whatever's inside the capsule, including the implant. Now, a total capsulectomy, could be the capsule's has been removed in 100 different pieces. Well, you can see the difference between an en bloc, right? We've still removed the entire capsule, but we took it out in many different pieces, right? So just keep that in mind when you're talking to surgeons and when you're thinking about capsulectomy, what the difference is between that. So when someone has a capsular contracture, like a hardened capsule, that's usually considered, that problem lends itself to total capsulectomy. We're taking the capsule out and completely, but sometimes we take the implant out first to make the procedure easier. It's also easier because that hardened capsule actually makes the dissection easier around it. So when someone has a normal thin capsule, and when I say normal, I mean normal looking and thin and soft and pliable, that's a more difficult operation, especially with the implant in it. That's the en bloc, and that's usually done for people with breast implant illness and that sort of thing, or let's say a known infection or something inside the capsule. We don't want it to spill out, kind of a thing. We try to take it all out in one piece. All right. Now, there's also partial capsulectomies. So the partial capsulectomy wouldn't really involve removing the implant necessarily, although we might be changing it for other reasons. But let's say an implant was too high and we wanted to drop the implant just for aesthetic purposes. Well, we can do that with a capsulotomy. That just means cutting the pocket on the inside, cutting it this way, maybe cutting it that way. But if we're actually, sometimes we want to remove some of that pocket to help drop the implant, well, that would be a partial capsulectomy, okay? That's kind of a different thing than a traditional capsulectomy, okay? So I hope that gives you some better idea of what a capsulectomy is and what it is.